Hi, this is Dr. Jayshree Sundhar, Director Obs and Gynae Madhukar Rainbow Hospital, New Delhi. I very strongly feel that whenever women have bleeding problems or any problems related to the uterus, we should think of conservative measures to preserve the uterus, because once we remove the target organ, that is the uterus, then we see that the woman has a lot of hormonal problems, that menopause sets earlier than later. So we have to offer them alternatives, and there are a lot of alternatives available for treatment. So removing the uterus should not be the first option, especially in places where we can keep them on a follow-up. So I would say that some measures, when we have a dysfunctional bleeding or somebody is having heavy erratic bleeding, we should offer them a transvaginal ultrasound to check what is the reason for bleeding, and simple procedures like hysteroscopy, that is putting in a camera through the uterus, seeing what the problem is, treating it immediately. It could be just a simple polyp, it could just be lining which is thick, it could be just a small fibroid which is pouting into the uterus. All this can be treated hysteroscopically. They don't need a hysterectomy for that, and most of the patients do very well. Also, hysteroscopy should be the gold standard for diagnosing problems, and we should not do blind procedures like DNC when we put the patient under anesthesia. So very important, hysteroscopy, minimal access into the uterus should be the option which is offered to all patients, and hysterectomy should be the last option, not the main option.